Hello everyone, my name is Tansy Campbell and today we're going to talk about secondhand smoke. Tobacco is a big issue today, and smoking is one of the leading causes of death among Americans, involving lung cancer, heart disease, and several other diseases caused through the smoking of tobacco and nicotine. So today we're going to talk about the effects of secondhand smoke. What is secondhand smoke? Slide 1. Secondhand smoke is also known as ETS, environmental tobacco smoke. It is a mixture of two forms of smoke called side stream smoke and mainstream smoke. Side stream smoke is smoke that comes from the end of a cigarette, pipe, or cigar. Mainstream smoke is smoke that is exhaled by a smoker. When non-smokers inhale ETS, it is known as involuntary smoking or passive smoking because it is not a voluntary act. Non-smokers inhale nicotine and other toxic chemicals just the same as smokers do. Slide 2. Why is secondhand smoke a problem? Secondhand smoke causes cancer. Secondhand smoke has also been classified as a known human carcinogen by national and international organizations such as the International Agency for Research on Cancer. Tobacco smoke has over 4,000 chemical compounds. More than 60 of those compounds are known or thought to cause cancer. Slide 4. Why is secondhand smoke a problem still? Secondhand smoke can also cause other types of diseases and death. There are 46,000 deaths from heart disease in non-smokers that live in smoking households. There are 34,000 lung cancer deaths in non-smoking adults. An increase in the risk of having low birth weight babies if you're pregnant, and 50,000 to 300,000 lung infections occur in children younger than 18 months of age yearly. Slide 5. Secondhand smoke and heart disease. One study among non-smoking Chinese women has shown that there is a positive association between secondhand smoke and PAD, peripheral artery disease, as well as CHD, coronary heart disease, and ischemic strokes. Results showed that of 431 cases of CHD, 172 cases of stroke, and 271 cases of PAD, 40% were exposed to secondhand smoke, and 87% were exposed to secondhand smoke in the home. Slide 6. Secondhand smoke on lung cancer. Consistent and clear evidence states that secondhand smoke is associated with lung cancer. Minimal exposure, however, does not impose a major risk. The Environmental Protection Agency has estimated that 3,000 people die annually in the United States from lung cancer caused by secondhand smoke. Of the 3,000 people, 800 are exposed to secondhand smoke within the home, and 2,200 from work or social situations. Slide 7. Secondhand smoke in pregnancy. Pregnant women who are often exposed to secondhand smoke have a 20% higher chance to giving birth to a low-weight baby than mothers who are not exposed to any secondhand smoke during their pregnancy. It is important to keep the home smoke-free for the sake of a healthy baby. If needed, stay away from environments where smoking is prevalent and tolerated, such as bars, casinos, and airports. Slide 8. Secondhand smoke in children. Children are at the greatest risk for exposure to secondhand smoke. They have an increased risk for bronchitis, pneumonia, ear infections, severe asthma, and respiratory problems. Infants who have been exposed to secondhand smoke are more likely to die of SIDS, sudden infant death syndrome, than infants who have not been exposed to secondhand smoke at all. Slide 9. Where is secondhand smoke a problem? Well, one place is in the workplace. There has been an increase in risk for heart disease and lung cancer in non-smokers in the workplace. The Surgeon General states that the only way to do away with secondhand smoke exposure at work is to ban smoking, period. There's also secondhand smoking in public places. Many public places have banned smoking. Some places are still worried about banning smoking as it will cause bad business, but there is still no proof that banning smoking in public places has caused bad business. Examples include restaurants, bars, airports, and malls. Smoking is also a problem in the home. Any member in the household can develop a health issue if there is smoking in the home. Children are especially sensitive. Even smoke on the clothing can create health issues such as asthma and bronchitis. A smoke-free home is most important for your guests, family, and pets. In the car, smoking is in such a tight, enclosed space, it makes inhalation of smoke much easier. Some states have even banned smoking in cars with passengers under age 17. How do you protect yourself and your loved ones from secondhand smoke? Make your home and car smoke-free. Don't allow anyone to get in your car and smoke, and prevent smoking yourself. Ask people not to smoke around you and your children. There are plenty of events that happen with kids and with family members, and we want to make sure that our children and our family is safe. Make sure that your child's daycare center or school is smoke-free. Choose restaurants or businesses that are smoke-free, and then thank those businesses for having smoke-free facilities. Believe it or not, some states still allow smoking in certain sections of restaurants. Thank businesses that allow you to have a smoke-free facility. Teach children to stay away from secondhand smoke. If you're the smoker, the best way to protect your family from secondhand smoke is to quit smoking. If that is still a work in progress, it would be best to keep your home and vehicle smoke-free and go outside to smoke. The only full way to protect yourself from secondhand smoke is to be in an 100% smoke-free environment. I would like to thank you for listening to my presentation on smoking, and if you have any questions, feel free to ask.